Hello, this is Dr. Kavya Milani for Virginia Medical Updates. One of the major issues in today's society in the U.S. is the issue of obesity and weight management. As we know, obesity is a major health concern, and the CDC has now considered obesity a major illness and a major disease. And as we all know, it does lead to hypertension, diabetes, types of cancer, sleep apnea, and multiple other issues. In general, the burden of suffering from obesity and unhealthy weight gain is significant. And in this series of programs, I would like to explain and discuss the etiology, the causes of weight gain, and some of the mechanisms by which a medically managed weight loss program can work, and also to go over the basic principles of calories and diet. For example, let's look at a 200-pound person that wants to lose about 20 pounds. Well, if one wants to lose 20 pounds, it is of note that the amount of calories that one has to burn, or the balance of calories in and calories burnt, has to be significant. And this is the formula for this. So for every mile that, for example, one chooses to jog or run, one can burn only 100 calories. And calories are a unit of energy. So if you can jog for 1 mile and burn 100 calories, to jog and lose the total of 3,500 calories, which is basically 1 pound, that is going to require jogging for 35 miles, which is actually more than a marathon. So you can see that just to lose 1 pound of weight through running or through jogging is a very difficult task. You almost jog a marathon and a half to be able to burn that amount of calories. The point is that a balanced approach requires cutting back on calories and increasing exercise level and increasing metabolism. So our 200-pound man that wants to lose 20 pounds then is going to have some difficulty, because as the body loses its calories, the body's defense mechanisms to maintain its weight actually goes up, and the body's metabolism slows down, and people basically begin to develop kind of a more sluggish metabolism and begin to actually become more ravenous. They want to eat more and more. And that's because of a hormone that the body produces by the name of ghrelin, G-H-R-E-L-I-N, ghrelin. And this hormone, what it does do is that it seeks to maintain weight, basically. And as people lose 20 pounds, the amount of ghrelin production in the body actually goes up and almost doubles. And it stays up for almost a year. So as this doubles, then basically people's appetite goes up, and people will then be much more interested in food and will become much more ravenous. And it becomes much more difficult then to lose weight. The major issue here for us in the medical community is that people always have these successful diets on major calorie restriction by any mechanism, any commercial program or any self-induced program or any fad that basically creates a major weight loss for a couple of weeks, like 10 pounds, 15 pounds, and then the weight bounces right back up, because then the body is fighting this particular hormone, and it is very difficult to actually balance that out. What we recommend is the gradual increase in exercise in an incremental fashion to increase metabolism with natural substances, products that basically increase metabolism. That package will create a gradual weight loss, and our weight loss will then be successful and can be maintained. In the next program, I do want to go over the major issues of obesity leading to diabetes, and how the pre-diabetic state and the metabolic syndrome can be controlled with medication and by the correct use of exercise and diet. Thank you.
Welcome to Virginia Medical Updates. My name's Alejandra Gonsalves, and today we will be discussing again cardiovascular risks and disease prevention. Today we have with us our very own Dr. Madhu Henry. Thank you for joining us today, Dr. Henry. Dr. Henry is a graduate from George Washington University, and she's been a primary care physician for 14 years. Today we're going to discuss the cardiovascular disease risks and prevention. And we had touched on this subject when Dr. Henry was last with us. And some of the things that we discussed were 9 modifiable risk factors, and we were spending some time on the importance of diet. So Dr. Henry, thank you again for coming. And let's discuss one of the first risk factors that we mentioned was smoking. How important is that on preventing cardiovascular disease?
Sure. I think that you had appropriately identified the fact that some of our modifiable risk factors are choices. Smoking is a great example. You have people out there that are making a choice. There are many studies out there that show that cigarette smoking is the leading avoidable cause of premature death. It's a major avoidable cause of premature disability. The other thing that I think is more compelling is that the amount of cigarettes currently smoked increases morbidity and mortality for cardiovascular disease. Another way to look at this is if you decrease the amount, you also decrease the effects. So oftentimes patients will come to us and think it's an all or nothing, but that's not the case. You could be a pack-a-day smoker and we could reduce to half a pack and still reap benefits from that reduction.
Okay, but of course the best option is going to be to actually quit smoking. So if someone is looking for, for smoking cessation to stop smoking, what is that they can do, in
that area?
Right. What else could they do if they come in to see you and talk about that?
Yeah, the benefits of cessation begin to appear after only a few months and reach that of a non-smoker within a few years. So I like people to think of a provider or the relationship with the provider as an opportunity to problem solve. You're intelligent, you are aware that this is a risk, it's not a new discovery, but thus far you've lacked success, and that's very common. In fact, studies have proven that it takes 8 failed attempts before you're at being successful at quitting smoking. Yeah. So I'm here to help you problem solve, and some of the modalities that I choose or I try to make available to patients or make them aware. So education, I try to educate them about behavioral modification. Oftentimes when a patient is desiring to quit, they need to prepare for it. Just like you prepare for anything big in life, you might need to pick a quit date. You might need to think about alternative activities you're going to do instead of smoking cigarettes. So it's to kind of bring their awareness to, oh, this is a process, and for success I have to plan for it.
Right.
With that, there's also medications. There are nicotine replacement options. There's several modalities. There's gums, there's patches, there's lozenges. There's a lot of opportunities there, and most recently now we have several pharmacological therapies to aid and assist. Some of the therapies are used to just make smoking less desirable, to decrease craving, and some are to actually give negative stimulus. So a patient, it's almost like a shock. The patient gets shocked and says, hey, that felt yucky, I don't want to do this anymore. But again, here's an opportunity to come in and discuss this and see how can we problem solve this together.
Okay, so there are other options, and you mentioned activity. I know that obviously that's something, physical activity, that seems obvious as something that someone could do to lower their risk for cardiovascular disease. Can you talk a little bit more about that as well?
Sure. I think that physical activity is always one of those that is kind of misrepresented. Many times we have patients who think they got to join a gym and they've got to get in 6 days a week and 60 minutes a day, or what's the point? An area in my resources when I was studying for this was, which I like to present and like to bring forth, was the idea that any exercise can benefit you, and that now we sort of quantify exercise. So many times we will describe exercise as by time spent. What that means is you can have people who have moderate intensity of exercise, 150 minutes a week. You can have people who have vigorous intensity exercise, 75 minutes a week. But then we have patients who are possibly limited exercise capacity. They've had some medical condition, neuropathy, or possibly suffered an injury or osteoarthritis. They're not able to weight bear. So we offer modified exercise strategies. The thing that I think is really important to keep in mind, though, that people who self-describe themselves as ones who work out are known to have decreased morbidity or mortality from a cardiac event. And these early childhood programs like PE that you go in grade school are known to decrease coronary risk, cardiac risk over time.
Okay, so later on. All right. So, yeah, so of course we know smoking, as you mentioned, and physical activity. If we can hopefully do that, then, obesity is hopefully not a factor if we're not, if we're trying to keep up with the physical activity. So for those who are obese, how does that affect their risk for cardiovascular disease?
In June of 2013, the American Medical Association made a controversial decision to qualify weight. They decided to do it by something called the body mass index.
Okay, yes, your BMI.
Exactly,
right.
Your BMI. So the BMI takes into account height and weight. It's not just your weight. So the BMI was used to kind of take into account that there are different body sizes, there's different fat and water distribution within the body. And it's given us a new parameter to talk about health and cardiovascular risk. So as opposed to being an ultimate one goal in weight, we've started to use a scale. The scale is on a 30 and plus point scale, but basically a score of a 19 as your BMI is considered underweight. A score of 19 to 24 is a normal weight.
Okay.
25 to 29 is overweight, and that's when we should start getting engaged in this. And a score of 30 comes that ugly word obesity, so obese.
Okay, but 19 to 24 is where we want to stay at. That's the goal.
Exactly,
okay.
Exactly.
Okay, so now we've discussed the choices that we can make as your patient.
Yeah.
And when we come in to discuss this with you, we can obviously, try for the physical activity, try to stop smoking, and work on losing some weight. But what about the aspects that are maybe not under our controls as much, our blood pressure or sugars? What can we do if that's not anything that maybe we're working on but we're not able to control on our own?
If we kind of go back to my original premise about this conversation, it was that cardiovascular disease is preventable, and it's preventable by modifiable risks. And those modifiable risks, one of them under the definition is hypertension. So I'd like to take a little bit of time to kind of define hypertension, but then to offer modalities of management.
And so for the hypertension, what can we do if it is something that is in the family?
Sure. Hypertension is defined as a blood pressure of 140 over 90 or greater. So when you go into the doctor's office and they put the pump on you and they get your blood pressure, the top number is that range of 120 or so, and the bottom number is a range of 80. 140 or higher or 90 or higher. So either number being high is considered high blood pressure. We as providers engage this when those numbers are between 120 to 139, that's considered prehypertension, or the lower number, the diastolic number, between 80 and 89.
Okay.
Again, the goal is for blood pressure to be under 140 over 90, and the target is 120 over 80. How do we achieve this? Weight reduction, salt reduction. There's multiple modalities of kind of attacking this.
Okay, so these are all things that we can do, but if it is still high, we can, like you said, the salt restriction and the weight. If it's still high after that, what is it that we can do if we come to see you in the office?
Sure.
Are there other options that we have?
Sure, and this is where we get into medications. So many patients are leery of it. They don't want to start medication. They say, if I get on a medication, I'll never get off a medication. Blood pressure is very sophisticated. It's not just your heart. Your kidneys are actually responsible for controlling your blood pressure. They're the sensing mechanism. So most of the medications are used, attack in a kind of single way. They either attack through the heart, They work through the kidney, or they actually simply just work to remove fluid, a diuretic to decrease blood pressure. So what I choose is very specific to the patient. But what the take-home point for me is, while you might be very resistant to doing a medication, think of the ultimate consequence of not doing a medication. People will always come in and say, but I don't want the side effect, I don't want the risks. What's the risks of not doing a medication? Sounds to me like it was a heart attack, a stroke, or possibly a infarct in your lung or in your lower leg.
And they could eventually come off of the medication if they're able to change those other risk factors that they can actually, the modifiable risk factors.
Absolutely.
So, and I know also cholesterol is another factor that maybe you might need to be on medication for. Could you touch a little bit on that as far as it having to do with cardiovascular disease?
Sure. Several large-scale randomized trials have talked about statins in individuals with clinical evidence of coronary heart disease, so blockages in the vessels of the arteries of the heart. They have shown to increase quality of life and decrease morbidity and mortality, decrease death in areas of stroke, heart attack, and other.
Okay, so that's an important
risks.
one as well. So of course cholesterol is one that we have to pay attention to, but I know diabetes, how can we touch on that and explain to everyone how important that is as a factor?
Sure. The big take-home point with diabetes is to understand the macrovascular and the microvascular complications. Macrovascular is organs. How's it affecting my heart? How's it affecting my kidney? How's it affecting my eyes? The microvascular are the little vessels that are going around throughout the body. So people coming in with numbness and tingling in their feet, or blurry vision, something in a very small kind of area where blood sugar might kind of collect and cause a problem, right? So I kind of like to make that as the big point so that people understand what diabetes is, and then define it and try to tell people, look for this, or this is what I look for in that screening physical.
Okay, so I see that basically we have to really make sure that our diet stays with lots, like we mentioned, fruits and vegetables, a lot of fibers, and avoid those donuts, avoid those sweets.
All the good stuff.
Yes, and in summary, those factors are basically to make sure that we're not smoking, have our BMI be lower than 25, and make sure that we're exercising. And we thank you very much, Dr. Henry, for being here. We've learned a lot today. I hope everyone has had a chance to learn something new. This has been Virginia Medical Updates. I'm Alejandra Gonsalves, and we hope to see you again next time.
This is Dr. Kavya Milani with Virginia Medical Updates. One of the most interesting books that I've read in the past few years is the book called Peak by Professor Erickson and Robert Poole. This book is a book that I believe will define an era. So I believe that if you think about the success and achieving peak performance, we all think that it is basically some hours of practice and some degree of training and some focus, and people will get to where they want to get. Professor Erickson, over the past 30 years, has studied highest achieving individuals. And the results of his 30-year analysis and study is astounding. It turns out that in 1973, the letter pi, the numerical value of which is 3.14159, and then infinity after that, was memorized up to 511 digits. Today, the record is held by an Indian gentleman with 70,000 digits memorized. The marathon record at the turn of the last century is now about 30% less than what it was in the turn of the last century. So it turns out that people's achievements have really been unbelievable. We are the same people, the same genetic pool, but people are able to do more astounding and amazing things. And Dr. Erickson has been studying this phenomenon. It turns out that he has a method that he outlines that's called deliberate practice. And he outlines how is it that violinists, musicians, chess players are able to achieve these astounding achievements without difficulty and without any lapse, and are able to continue to improve. The most important thing about his studies are that they basically are able to document from a neuropsychological point of view what happens. You know that, for example, the stages in studying, the stages in hard work, the kind of feedback that we need to achieve in any field is very specific. And Dr. Erickson has meticulously researched all of these, and he has accumulated this whole amount of knowledge and an amazing methodology in actually a very fun and a very interesting and lively book. I highly recommend this book for everyone who wants to understand how genius works and how is it that each and every one of us can begin to, at any age, explore some of these innate potentials. This book is not a self-help book. It is not a flimsy book. It is a significant landmark study that really will be a book that will be taught for years to come. And Professor Erickson's research is really paradigm shifting. If there was a paradigm before him, there's definitely a paradigm after him. And he has basically redrawn the landscape on how genius develops. I highly recommend his book called Peak, which is a survey and summation of 30 years of significant work. How do great violinists become great violinists? How do great gymnasts become great gymnasts? How do amazing chess grandmasters dominate the scene of the chess? And how is it that other people that have tried very hard have failed, even though they put hours and resources towards this? And the other question that he raises is the question of motivation. What motivates people? And so therefore, his work is in a real sense groundbreaking. I highly recommend this book. I've used this book with a lot of my patients, and I believe that people have found this book to be very, very useful. And I think parents should read the book, and I believe that every individual like myself who wants to be able to do something different and do better in any field can stand to benefit a lot from this book. The book is Peak by Professor Erickson and Robert Poole, and I highly recommend it. Thank you.
Hi, it's Dante Davis here again with Virginia Medical Updates, and this is our second fitness session. Thanks for tuning in. You guys have been great. Today is more of a plyometric type of day, so a lot of jumps and a lot of moving around to get the heart rate up. For our lower body, we're going to focus on what I like to call single leg jumps from side to side. We're going to go for time. We're not going to go for reps. Quick demonstration. You guys will start on your left leg and hop to your right leg, and then hop back and keep going back and forth as if you're skiing. Keep it going. We want a steady pace for 20 seconds. And push off, push through the heel. Really, you can feel it in your butt area, hamstrings, and your glutes. All right, time. Keep that going. We want to do 3 sets of those. Really emphasize on pushing off of a single leg, left leg, right leg, back and forth. Next plyometric we want to do, we want to focus on what we like to call lunges, but we're going to do running lunges. Here we go. Let's pick it up. Let's pick it up. There you go. Keep it going. Keep it going. Jumping off left foot to right foot. And keep those arms swinging as if you're running. Good job, good job, good job. So that finishes up our lower body circuit for today. Make sure you guys build up that heart rate and move at a high pace. For our first upper body exercise, we want to focus on a regular plyometric push-up where we're here and we're pushing off the ground and clapping our hands. If you can't do it in your regular push-up form, stay on your knees, no problem. We're going for 3 sets of 8. Here we go. Clap, clap, clap. Really push off the ground and get height. 3 sets of 8. Focus on pushing off, exploding up off the ground, building up the pecs, shoulders and triceps, and you're gonna be great. It's a great workout to build upper body strength and explosion and power. For the next upper body exercise, we're gonna go side to side with our plyometric push-ups, here to here. And again, men and women, if you can't do them in the regular push-up form, right on your knees, no problem. Here we go, 3 sets of 8. 1, 2, 3, 4, 5. Get some height. 6, 7, 8. There we go. Whew. I know I'm feeling the burn. I know you can too. So let's keep it going. Core. This is what everyone loves. I know everyone out there will love the 6-pack and the abs and to run on the beach. So we're gonna focus again on the core, upper core, lower core, with a couple exercises. For the first core section, we're gonna do regular sit-ups to crunches to toe touches. So we're gonna do 15 sit-ups, 15 crunches, 15 toe touches. 10 sit-ups, 10 crunches, 10 toe touches, 5 sit-ups, 5 crunches, and 5 toe touches. Here we go. Let's go. 15. 1, keep the core tight. 2, 3, 4, 5, 6, 7, 8, 9, 10. Keep your hands on your head. 1, 2, 3, 4, 5. Right into the crunches. Here we go, 15 crunches. Feel the burn, feel the burn. 14, 15. Now here we go, right into the toe touches. We did these last week. Reach for the toes, keep the core tight. 10, 5 more. 1, 2, 3, 4, 5. Now, that concludes our workout today. Thanks for tuning in. You guys have been great. The fitness journey is great. I'm Dante Davis, and thanks for watching Fitness Session 2.